Alright guys, in today's video we're going to discuss inserting a urinary catheter for a male patient. So to do this is pretty simple. There's a lot of reading on here, but just some little tips before going about this procedure. We want to make sure that we use the smallest size catheter possible to minimize trauma to the urethra for obvious reasons. We don't want to insert a large catheter in like a smaller hole, male or female, to reduce the risk of infection, and you do not want to create trauma to the tissues. So to begin catheter insertion, you're going to perform hand hygiene. Obviously, like, super important. We want to decrease that risk of infection. Explain the procedure to the patient. Make sure that he or she agrees that you're going to be inserting a catheter into their urethra. You know, it's kind of an invasive procedure, a little uncomfortable. So when you begin, raise the head of the bed to an appropriate working height. Face the patient. Stand on the left side of the bed if you're right-handed, on the right side if you're left-handed. This is really important to help you get like a grip. Make sure you have a nice angle for your dominant hand. If the side rail is in use, raise the side rail on the opposite side of the bed and lower the side rail on the working side. You're going to then place a waterproof absorbent pad under the patient. Assist the patient to a supine or sitting position with the thighs slightly abducted. Support the patient with a pillow if needed to maintain his position. You're going to cover the patient's upper trunk with a bath blanket or sheet and cover the lower extremities with a blanket or sheet, exposing only the genitalia. You know, we don't need them being fully naked if possible. Wash the perineal area with soap and water as needed and dry it. Discard the supplies, remove the gloves, and perform hand hygiene. So when you grab your kit, it's generally going to come with a specimen cup, a sterile drape, sterile gloves, and dwelling catheter, cleansing solution, sterile saline. Some catheter kits I've found come with betadine, some do not. So just so you're prepared, either read the kit before or just grab a little extra betadine just in case, because that's important for cleaning. Open the sterile inner package containing the catheter supplies. Using sterile technique, open the top flap outward to the far side of the kit. Then open the side flaps without bringing the arms back over the sterile packaging. Open the last flap toward yourself. Note that the tray is now sitting open on its sterile field. You're going to place a waterproof sterile drape on a fenestrated drape appropriately. The sterile drape. If sterile gloves are packed in this first item, don them and apply the drape. You don't want to touch this drape with regular gloves or just your hands because it's in a sterile packaging. Everything in the packaging is sterile, so you must touch only sterile with sterile. Remember that. Maintain sterility of the drape and let it unfold. Fold the drape of the edge away from the patient to form a cuff over both hands. So after you get your drape placed, move the tray or box on the sterile field closer to the patient and organize the remaining items on the sterile field. Form a continuous sterile field with the sterile wrap under the tray or box and drape under the patient. When you set up your equipment with the catheter, you're going to hook your syringe to the catheter, but do not inflate the balloon. Okay, that's a big no. Just inflate it after the catheter is inserted into the urethra. Open the package of sterile antiseptic solution and pour the solution over the sterile cotton balls. If the kit contains sterile antiseptic swabs instead of solution, open the package with the stick ends up for access. So place the catheter tip in the lubricant, and then you're going to cleanse the urethral meatus. With your non-dominant hand, if the patient is not circumcised, retract the foreskin. Grasp the penis at the shaft just below the glands. Gently spread the urethral meatus so the opening is more visible. Maintain the position of the non-dominant hand throughout the procedure with the dominant hand. Remember, once you place your hand, your non-dominant hand, onto the patient, it stays there. Your other hand, your dominant hand, needs to be sterile at all times. You're going to grasp the antiseptic soaked cotton ball with forceps, or pick up the antiseptic swab stick, which could be the betadine as I mentioned earlier. Clean the penis by moving the cotton ball or swab in a circular motion from the urethral meatus down to the base of the glands. Repeat cleansing using a clean cotton ball or stick each time. So after your cleaning is done, we are then going to insert the catheter. So you're going to lift the penis to a position perpendicular to the patient's body and apply light traction. Ask the patient to bear down as if to void. Then slowly insert the catheter through the urethral meatus. Advance the catheter until urine flows through the tubing. Do not inflate the balloon until urine flow appears. Early inflation may injure urethra. Continue to advance the catheter to the bifurcation of the tubing. So just like a little tidbit, when inserting a catheter in a male or female, the catheter is going to go in further than a female's urethra because males have a longer urethral tract. Keep that in mind. If resistance to the insertion persists, the patient may have an enlarged prostate or a urinary abnormality. Notify the practitioner. A Coude catheter with a slightly curved end may be needed. So again, the Coude catheter is different than a urethral Foley catheter, as it says here, with a slightly curved end. So for difficult catheter insertion, sometimes you may have to use a Coude. A Coude catheter, you're going to do the same technique as before. So also with the straight catheter, if you need a straight catheter, that's for someone who has urinary retention as well, but may not need to have an indwelling urinary catheter. Okay, so if you want like a specimen collection, we're also going to clean. It's sterile. It's like the same thing as a Foley catheter, but you're gonna insert the catheter and then you're gonna drain the urine and then you're just gonna take it out. I suggest that you also bladder scan before and after to see how much urine was in before, how much you got out to make sure that you emptied properly. So these are just like basic steps to inserting urinary catheters, kind of like the most basic skill that you first learn going through nursing school. Here are some pictures, some visual aids to help you identify the procedure here on the side. Real simple, guys. You can pause, screenshot, take your time going through all of this. And just with that, that ends today's video.